In a democracy, citizens need to be informed. Informed about policies, issues, homelessness, law enforcement, and social services. In order for people to make good decisions that affect their lives, they need to be informed. Conversations with Erroll Parker. Hello, everyone, and welcome to Another Side with Erroll Parker. And today on our program, we have three guests. One is Dr. Anissa Davis, and she's going to be talking about the COVID-19 virus as it relates to Long Beach, Los Angeles County, and even around the country. There's been a recent tremendous spike in the COVID-19 cases, and Dr. Davis, who was the health officer for the city of Long Beach, Health and Human Services Department, a department that I worked for over 30 years, and she's going to explain to us about the spike in the cases of COVID-19 cases, about the vaccine, and about the opening of businesses and schools. Welcome to our program, Dr. Davis.
Thank you. Thanks for having me.
Now, we have the country and Los Angeles County in particular has experienced a tremendous spike in the cases of COVID-19. Can you explain what are the reasons for this spike?
So the first thing that's of note with the recent spike is that most of the cases are in the ages of 21 to 30-year-olds. And so when you look at what that age group is doing, it is a lot of gathering and parties, lunches, dinners, where they are not wearing masks, physically distancing, they may be in enclosed spaces, and things like that. So it's basically not adhering to the precautions that have been laid out in order to minimize the risk of COVID-19 transmission. So that's kind of what we're seeing right now.
So you're saying it's the young people who are really ignoring the cautions and the warnings from public health officials and on the media about gathering. Is really what you're experiencing is an upload in young people who are not taking the virus seriously. Is that what you're saying?
Well, so I can't really say, I don't know how seriously they're taking it. I mean, they are weighing their risks and benefits, and they are deciding to still get together and go out, play sports together, soccer and basketball and things like that, just different high-risk activities. And that is one of the big drivers of what's happening right now. And the concern is that right now it's in the 21 to 30-year-olds, but who do they live with? Who are they around? Are they around their parents, their grandparents, what have you? And are they going to pass this infection to these higher risk individuals? Because we do see that as you get older, that's where your risk of serious outcomes from the disease happen, either hospitalization or in rare cases, death.
Dr. Davis, I'd like to go over some data with you, some Long Beach data in terms of hospitalization, deaths, people who have been infected compared to maybe a couple of months ago. We've seen a spike, but can you give us some hard data in terms of the numbers about the COVID-19 virus as it relates to Long Beach?
Yes. So what we've seen is a very kind of recent uptick in the number of cases that are reported on a daily basis. So if you were to go back to the end of September 30th, there were 50 cases reported that day. Then if you go to October 28th, there were 45 cases. And then if you kind of fast forward to November 16th, it's 130 cases. And really since November 14th, we have not been under 100 cases. So every day since November 14th, we have been consistently over 100 cases, and the numbers have kind of just continued to creep up. What is reassuring right now is that our hospitalizations have remained fairly stable. And so when you look at the hospitalizations, when you look through September and October, on any given day, we have anywhere from 32 to 50 or so people hospitalized because of COVID-19. When you look more recently in November, in these last week or so, those numbers have stayed the same so far. So we're still in the 30s. We're still, low 30s, high 30s, sometimes we hit 40. So that's reassuring right now. And I think that speaks to the fact that right now it's younger people who are becoming infected and they have a lower risk of being hospitalized. And so we will need to monitor that to see where that ends up. And then in general, what we've seen throughout the nation, and so we're also seeing in Long Beach, is that what we call the case fatality rate. So that's out of everybody who has COVID or everybody who's been diagnosed with COVID, how many of these people die. We've seen that continue to decrease. So we are hopeful. We know that part of that is because, again, it's younger people, but we think also just the fact that we've been living with this pandemic for 7 or 8 months now, that doctors and healthcare providers have become much more experienced in treating it. And so because of that, we are seeing less of a death toll. And again, we'll have to continue to watch. Nationally, they are starting to see deaths kind of tick up in different states. And so we'll just have to keep a really close eye on what's going on in California. And I think that's why the state is really moving quickly to try to continue to really monitor and put in restrictions to minimize transmission.
Now, a daunting task is before you on the horizon. Vaccines, a couple of vaccines have proven to be mildly successful. There's been encouraging around the country. Now, the daunting task, if these two vaccines prove to be successful, now is the time to inoculate people. That's going to be quite a task. Can you give us any insight on how we're going in Long Beach are going to get as many people inoculated in that period of time? Is that going to be, I know it's going to be a very difficult task.
It will be a daunting task for everybody. There's several logistical issues that need to be addressed, and we are currently monitoring and planning for those logistical issues. The vaccine needs to be approved, first of all. Like you said, there's 2 vaccines that show good promise. Pfizer just announced today that they're actually done with their data collection, and they plan to submit their data to the FDA for approval very soon, within days. And once that happens, so there's several steps before it will come to us in order to vaccinate. And the part that we need to plan for is that when the vaccine is first released, there's going to be very limited supplies. It's not like there's going to be this huge amount all at once. And so we need to make sure that we're prioritizing the highest risk individuals to get the vaccine the first go around. Your healthcare workers, your folks with underlying health conditions, your older folks. Then there's a lot of logistical issues with the vaccine itself. It has to be kept really cold. There's limited freezers that can become that cold. You have to pack it with dry ice. So there's numerous steps along that. And so we are in active planning with our city stakeholders in order to really look at those logistics, see who can receive the vaccine, who has the type of food they need, how many people they need to vaccinate in their entity, and then what part of the health department, we will also be vaccinating people. And so, making sure that we have all those logistical situations figured out. And we've actually used our flu pods or point of dispensing clinics as an exercise, which we've been doing for several years. And we've done numerous of them this year because we knew that the COVID-19 vaccine was coming. And so we used influenza vaccination clinics to really hone our skills of providing mass vaccination to thousands of people in a timely and efficient manner.
The elephant in the room on this thing is a lot of minorities are very suspicious of inoculation, particularly the African-American community. How are we going to relieve those fears that people, if the vaccine is approved and it proves to be plausible, some people are afraid to take this inoculation, and you being African-American, me being African-American, we know why these fears are. What are we going to do to mitigate those fears so these people can relieve these fears and get inoculated?
So I think it's really important for us, everyone on the federal and state and local level, to acknowledge the fears and concerns and to work really closely with our community in order to really make sure that we are communicating and using our chains of relationship that we already have to explore vaccination for communities where there may be more concerns. And I think that the important part that we need to make sure that we're highlighting is that this is a long game. It's not a short game. You can't go out and do like 2 or 3 press conferences and think that you're going to get an entire community to become vaccinated to a new vaccine. So I think that it's really important to have ongoing conversations with communities that we have relationships with, and really meet people where they are, address, what the concerns are, and to continue to dialogue and to make sure that vaccination is available when people are ready to be vaccinated.
Very good point. Let's talk about the schools and businesses right now. With the uptick in COVID-19 virus, some businesses and schools are closed, and what's on the horizon is that they may have to continue to be closed. What type of measures are you going to be taking in terms of making sure that the schools stay open as much as possible, but the businesses are closed and they're suffering and the kids are at home because of school? What is our position as a city in terms of trying to reopen schools and open businesses so the economy and education could take place?
Yes, our position really is weighing the balance and walking the tightrope of ensuring that people's public health is protected and that our economy can flow and our children can be educated. And it is a very difficult line to walk. There's many variables that play a part on both sides. And the condition in our country and in our city changes really rapidly. So you could be looking fairly okay in August or September, and then in a matter of 2 weeks, you need to make some pretty drastic changes. And it's really difficult for businesses and for schools. I think the other thing that's important is that even when things are, when we as a city and a county were kind of okay, we were stable, we've always been in the most restrictive tier. We've always been what the state says or considers widespread community transmission. So we've basically, since I think May or April, have been in a widespread community transmission. And so it is very difficult. It's very difficult to have businesses open as usual and schools open as usual. But that is certainly our goal. It's in this very difficult times. Some of what we can open and close, much of what we can open and close is predicated by the state. The state is who puts forth that guidance and those recommendations. So being in the most restrictive tier, we are not able right now to open schools. We can open elementary with a waiver, and we've done that to the extent that we felt was safe. So right now that's transition from kindergarten to 2nd grade. And so we're working on that, and we're trying to make that as safe as possible and really working with our schools very closely. And then we're trying to have our businesses open as much as we can as well, again, trying to mitigate this, the transmission of the virus. So it is very difficult. I think, I really applaud everyone who has made these sacrifices. I know that it's been very financially difficult, and it's been very emotionally and psychologically difficult to not have your children in school. And I think we're all just trying to do the best we can to keep people safe, as well as trying to have education in the time.
Final question, Dr. Davis. Because the health department is not tied with the county, we're kind of sovereign. What latitude do we have as a city, or the health department has, in terms of how a business can operate? Because Berkeley has a health department, and I think maybe one other city. But do we have any latitude in terms of how businesses operate during this pandemic?
So thank you for the question. So there are three, like you said, there's three city health departments. It's Long Beach, Pasadena, and Berkeley. And early on, and we are independent health jurisdictions, so we are completely responsible for all of the public health, just like all of the county jurisdictions are responsible for the county. And so Los Angeles County Health Department does not have jurisdiction over Long Beach residents. We do. In this situation of this pandemic, the state made a decision that they were going to determine how much you can be open or closed on a county level. So they made the decision that they were not doing it by jurisdiction, which would be 61 jurisdictions. They were going to do it by county. So they were doing it by the 58 counties. So we are a part of Los Angeles County, and so we are in their tier. So their numbers, our numbers feed into LA County numbers, but it's their numbers that determine what tier we can be in. So we cannot move, even though our numbers might look like we're in a less restrictive tier, we have to stay with LA County. Within that, so we have to stay within LA County, but within that, we do have latitude what we want to do in that tier. So for instance, in the purple tier, which we're in, you can allow retail, indoor retail, up to a certain occupancy. So we could say, we don't feel like it's really time to open up retail, and we could be more restrictive. LA County could say, no, we don't want to open retail, and we could be less restrictive. So we have latitude within that tier, but we can't move out of that tier. So if that makes sense.
Yes.
Yeah, and we have really tried, because much of what LA County is going through, we are going through as well. We've really aligned really closely and had a lot of discussions with Los Angeles County, because I think the more you're doing things together, the more successful you'll be with COVID-19. It's very difficult to have little pockets of places that are being less restrictive, because there's so much movement of people. You live one place, you work another place. It's all going to kind of you're going to end up in the same place anyway. And so we've been very closely.
Well, Dr. Davis, thank you so much for taking our time in your busy schedule. I know that this is very, very challenging, and give us a few minutes to talk about and get it straight from you, the Chief Health Officer for the city, about what's really going on with the vaccine and with the hospitalizations. We really appreciate you taking time out of your busy schedule to chat with us about it. Thank you so much.
Oh, you're welcome. Thank you for having me. Everybody needs to get a flu shot.
I got mine.
All right.
All right, Dr. Davis, thank you so much.
Take care.
That was Dr. Anissa Davis, the Chief Health Officer for the City of Long Beach Department of Health and Human Services, giving us the reasons for the uptick in COVID-19 virus. We want to thank her for being on the program, and we'll be right back with another guest on our program.
In a democracy, citizens need to be informed about policies, issues, homelessness, law enforcement, and social services. In order for people to make good decisions that affect their lives, they need to be informed. Conversations with Erroll Parker.